Good morning. You'll be pleased to know you will still have coffee shortly after this. So my question is, so what? And I have to say the last session reinforced in my mind the importance of this question. I listened to the sessions yesterday and I ask again, so what? I'm not for a moment suggesting that the people who are promoting and talking about what they are doing are not sincere. I'm not for a moment suggesting that they are genuinely trying to do good for the citizens of their respective countries. But I do worry about the fact that this reminds me so much of meetings in Europe, where you go and what happens is you see the same people talking to the same people about the same problems, and the only thing they ever agree, is to meet again to talk to the same people about the same problems. And nothing is ever actually solved. We hear of strategies. I must be honest, I'm sick and tired of that word. Because we hear of initiatives, we hear of all new terminology, which actually, in a way, seems to me to mean that there are parallel universes, I sometimes think. There are really good intentions, and I really do want to make that clear. But I really, really worry about the fact that last year, the year before, and possibly next year will produce the same so what. My questions are always, what has any of this ever done for patients on the ground? Why is it that all the people out there who would like to know about telecare, telehealth, etc., don't know? We keep talking about the problems. I need to understand where the solutions are. And I don't see many real solutions. Now, when you walk around the exhibition hall, you can see that solutions are available, both from a technical point of view, from a services point of view, from a training perspective, from a procurement perspective. But somehow or other, that hall seems a long way away from what I see as the reality on the ground. So I'm not only talking about the UK here. We spend a lot of time traveling around Europe, North America, and most recently China. You'd be interested to know that many of the same discussions that we've had here yesterday and today are also being had in those countries. And I must be honest, it fills me with despair. The difference, however, is that in certain countries, notably, for example, the Nordic countries, they've actually just gone out and done things. Eddie had mentioned earlier something which I think is really important, Eddie Ritson. And that was this question of risk. Remember, in almost every case here, we're dealing with the public sector. In almost every case, we're dealing with people within a department, which is risk-averse by definition, which has these long, drawn-out processes, which do very little for innovation, and in many cases, block innovation. I remember a couple of years ago at one of our meetings in Belfast, a very eminent clinician stood up. He's a very innovative clinician. And he said, I've just realized that from the moment someone suggests an innovation to actually implementing it, 18.5 years. By definition, it's no longer an innovation. But that's what happens. That story is not peculiar to Northern Ireland. That story is told time and time again throughout the whole of Europe. There are places where they've done certain great things, like Catalonia, for example, with their personal care records. They've moved ahead of us, far ahead of us in many ways. So I suppose my question to you, and I'd rather now stop speaking and ask you to give comments and make this more interactive. So what? Are we any further on than we were a couple of years ago, was my first question to any of you. Is there any hope, is the second question. Are we just going to go on meeting regularly and talking to the same people, no matter how pleasant it is, and never finding real, on-the-ground deployments and solutions of existing solutions? So I guess, has anything changed in the last couple of years? Does anyone want to comment and stand up and tell us of the great success story of real deployments? Or am I hoping for something that doesn't really exist?
Is open. You've had the challenge, and in a way we've had a rather cozy consensus over the last 24 hours. A lot of things that probably make us feel comfortable about what's happening, but at the same time frustrated. Some of the things that we heard from NHS England yesterday, perhaps not entirely clear, and issues of that sort. We've had a really powerful challenge. So can I see the lights down so I can actually see some hands, so I can actually see who would like to respond to what has just been said? I can see a hand right at the back there. Can we get a microphone to them? And if I'm not mistaken, I think that's the only social care voice in the room.
You're right, Paul.
Yeah.
My name's Mike Smith. I run a private care agency called Trinity Home Care. I think I'm the only social care provider I've met here.
Is that true? Is anyone else here from social care? Okay, there you go. You can join up.
Welcome.
And form a huddle later.
Okay, so I'm not quite the only one, but I feel like almost the only one. And I agree with a lot of what Brian said. I mean, there's 850,000 people out there with dementia. I think I've heard dementia mentioned once in the whole conference. These are the people, these are the users that will benefit from these services. We've got a social care system that's bankrupt. As a provider, I can't continue to recruit and retain people in a linear basis, whereby I can only provide services to people as I recruit people in increasing numbers. Those people aren't out there in the markets I'm in. So I want to innovate my proposition, my value proposition to my customers, and they're the people that you guys ultimately need to be selling into. So I agree with what Brian said. I think there's a lot more that can be done to engage with social care providers, because we're the people that really understand what the users want. And we're also quite a good route to market when you can't sell into, through local authorities and CCGs, because the procurement cycles are just too long.
Yeah.
So there's my pitch.
Thank you. Anybody else?
Yeah. Other contribution? Yep.
It's another social care provider, I think.
Yeah, it's a social care voice again.
Social care provider number 2. We've been in the organisation I work with, this is learning disabilities, which is cognitive impairment, similar to dementia in a lot of ways. We've been doing this for about 10, 12 years, and it was regarded before the recession as added value. The recession hits, and suddenly we want to cut down night staff. However, we think we should be doing this anyway, and I've got a team of 7 people who do this in our organisation, funded by charitable giving.
Right.
The problem is the commissioners don't commission this stuff, the regulators don't regulate for this stuff, the training is not mandatory, there's no requirement for competence. The system needs to change, and I spoke to the chairman about 5 years ago about this. So get back in the coalition and please get it sorted. Thank you.
Next, we move on quickly.
Yes, definitely move on.
Anyone else?
Yes, a
Lady here.
hand, voice from Spain, I think.
Thank you, Brian, for mentioning us. I'm working for the Catalan government. We were presenting yesterday
I know.
what we've achieved in terms of digital health and care. So what? My idea is that you here in the UK, you are really great researching, publishing, and creating knowledge and understandings. So it's really great for us to pick up this really strong knowledge that you are creating, and we use it.
Yes.
So then we do things. Maybe not in a really clear way or a strategy, but things are happening, and are happening in a very multi-level thing, and a lot of things are happening at the same time. So, yeah, in the UK maybe it's more or less the same. I mean, there are some few things happening, but I don't know. I would say that we are really using what you are creating in terms of knowledge, evidence, and position papers and charities publications. But we really use it, and it's really useful for.
And can I ask you, do you think the UK therefore is very good at all those things, but doesn't actually implement?
I don't think so.
No, it's good that you're using all of this good stuff.
Yeah.
But
for us, it's great.
yeah, it is for you.
For
And I know
for us,
I was in Barcelona last week,
Yeah,
actually,
I know.
as you know,
Yeah.
at our ecosystem meeting, and it was clear that there is a combination of all the stakeholders in a room actually doing real things which can only be done together, which includes social care.
Yeah.
Because social care too often is seen, in my view anyway, as the poor relation. It's pushed to the side very often. But it seems to me you're making the point that we're good at lots of things here. My contention would be we're pretty bad at implementing, because we keep reinventing strategies, and if they don't work, we call them something else and announce them again. That may seem harsh to some of you. Any other questions? Thanks very much. Thank you. Gentleman here. Yeah.
Andrew Gardner, TSA and Medvivo. I mean, I think the example of Catalonia is really good, and I think it's because they've got two things in place. One is they are all talking together, there is a system, and social care, healthcare, hospitals, primary care are all talking, and the other is they've got a healthcare record. I think what I see in this country is the competitive environment between, GPs don't like hospitals, hospitals don't rate GPs, hospitals need to drive up activity. No one has got a look at the total economy. So their so what is, what does it do for me?
Yeah.
And therefore, for me, one of the biggest concerns is prevention. No one's interested in prevention because it prevents something elsewhere. And therefore, until we, get everybody talking, maybe move to accountable care organisations, I think it'll be very difficult for this industry to really make progress.
Okay. Let me just pick up on that point. I had a specific example in Manchester at one point where after a survey of what was trying to create integrated care, this is about 2-3 years ago, I remember having a conversation with the chief executive of one of the largest hospitals in Manchester. And in integrated care, there are clearly shifts in budget. So he was told that really, if he moved people out and kept them in their own homes, discharged more people, etc., 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 he would be able to reduce his staff from 2,500 to 2,000. Natural wastage over a 5-year period. His response was as follows. Number one, you are trying to destroy my empire. Those were the exact words. And number two, there is no way I could lose that number of staff by natural wastage. So I said, how many have you lost in the last 3 years? Well, I have no idea. I said, well, that's what makes me question why you're a chief executive. But leaving that point aside, the reality is you lost over 600 people. The problem was you replaced every one of them. So you have this empire builder mentality, not everywhere, but in lots of places, not only in the UK. Can someone maybe address this other question? Is there any hope? And if there is, could you tell us where it is? Who's brave enough to try that one?
Alison wants to have a go.
Yes,
But anyone else like
there's
to have a go
always
as well?
one.
There's definitely hope, Brian.
Okay.
That's why we're here. That's why we're passionate. That's why we're making a difference. That's why we're collaborating with you, Brian. You're on that stage being bold and brave and telling us these people want to hear what you're saying there. I'm right there supporting whoever wants to collaborate with TSA, ECH Alliance, and let's make it happen. Let's do what we say every year, every November, every time we meet. Let's make it happen. We've made inroads. Come on, let's do it. We might not be liked, but at least we'll make some change.
Anyone else? Sorry,
Right
lady
over
there.
here.
Sorry.
Hi, is this on? Liz Ashaw-Payne. I just want to reiterate what Alison said there. So I do work with both TSA and the European Connected Health Alliance. And I think one of the most exciting things about both of those organisations are that they bring together all the sectors as partners. So when you're talking about some of those disincentives and egos that are around the table, by really working in partnership, that's where you'll get the benefit. I think the other thing that both of them really strive for is to put the person at the centre. And I actually really believe it'll be a consumer-driven change. And somebody's raised that this morning about how people, we all have these now, we're all using a lot more technology ourselves, and we're going to have to keep up. So it's going to be a bit of a survival of the fittest. So I'm definitely staying aligned to the European Connected Health Alliance and TSA.
So there's maybe some hope. what strikes me is, though, there are very few people in the room who have leapt to their feet and go, Brian, don't be despairing. There's hope. Why not? I wonder if you're all beaten down by the never-ending pilots, the never-ending bureaucracy, the never-ending regurgitation of policies and strategies, which, to me, always seem to be the same thing, same old, same old. Another one over there, another lady here. Thank you.
Hi. Hello. Ali at Tunstall. I want to just say a few things, but I probably shouldn't. We should really stop beating ourselves up. There's so much negativity I'm hearing, but you know, we shouldn't be blaming the politicians. We shouldn't be blaming health, social care, housing. It's their fault. They don't know it's there. There's no awareness, blah, blah, blah. Let's just see at what we have achieved. My question to the panel earlier, I put on Twitter, was, what does good look like for you? Because at the moment, I'm seeing lots of good. You know, I could quote you lots of things, but I'm not going to. I'll maybe do, actually. I'll say one thing. In Birmingham, there are 14,000 people who are benefiting from connected care, telecare, similar things like that. And if you look at that population as a whole and compare that to the English average of over 65s who fall, apparently the average number of fallers per year is about 45% of people over 65 who fall once per year. If you look at those people in Birmingham who are benefiting from the services that they're provided with through connected care, the percentage of fallers is under 10%. Now, those numbers aren't published yet, but they will be soon. There is an enormous amount of success going on. And if we don't know about it, then whose fault's that? You know, just open your eyes. It is out there. So I'll just say, like, that my frustration for what I'm hearing this morning is there is a lot of good out there. And the question, so what? Go and see this good stuff.
Yeah, okay. It's a good challenge that. Let me say to you, first of all, you're from Tunstall, so you know all of that because you're delivering a lot of that and you do a great service. I was with Tunstall last week where you got 500,000 people or whatever it is in Spain being monitored and treated or looked after by yourselves. The reason we don't know about that, right, is it's not widespread enough. It's great, don't get me wrong, I love what you're doing, but tell me, why is that not happening in every city? Why is that not happening in every nation in the United Kingdom? Why? So.
Is it on?
It's on now, yeah.
It's on now. It's not happening in every city, and it never will.
Right.
You know, everyone has their own ways of doing things, but we can't just blame them for not doing it. Explain the successes that are happening, yes,
Yeah.
make people aware of them. It will happen eventually. We've got to be patient, but let's stop complaining and carry on.
Okay, I don't think what I'm doing is complaining. I'm simply stating the facts. You know, to say that we should just, don't worry, and by the way, I agree, we should promote the successes, and we don't do enough of that. But your answer to my question is, be patient. We've been patient for 20 years. Why does it take so blooming long? When people out there are actually suffering, there are initiatives right now. There are not even innovations. There are real products and services in the exhibition hall, which right now could help real people. Why are they not being bought and if you like, scaled up and deployed on a bigger scale? I think we saw some of the answers this morning. It's risk averse by governments. It's a constant changing of policies. It's a constant blaming of budgets. It's a constant failure to understand that their first responsibility is not to themselves, but it's rather to the citizens that they're supposed to be serving. And in fact, they don't, in my opinion, in a lot of cases. Good success stories, let's have more of them. TSA can promote them. We would promote them. There aren't enough of them. That's my view. Any other questions? I know we've got to finish.
Haven't got time for questions, I'm afraid, anymore.
Have we not? We're finished,
But
okay.
Brian, a very important challenge. I'm certainly going to be reflecting upon that in terms of what I say at the end of today as well. I suspect that's really going to be the kickoff of a lot of conversations over coffee.
Good.
We're going to break now for coffee, reconvene after coffee for a panel of contributors from health, housing, social care, to get a range of perspectives. But it's really good to have your contribution. Hope it's fired us up, maybe to not be quite so shy about talking about what the sector's contributing. Thank you very much, Brian.
Thank you.